First, echo what Senator Braun said. Second, I'll thank each of you for taking the time out. I know how busy you are and appreciate you coming and answering questions. I grew up, like most of us, I think, looking at our pharmaceutical companies as treasures, as companies that America could be rightfully proud of as innovators. But that's slipping away. When I'm back in Colorado, I hear let's be gracious and say a wider diversity of opinion. According to a recent YouGov survey, more than a third of Americans reported that cost has prevented them from filling a prescription they need. A separate Kaiser Family Foundation poll, this one just from last year, said that 83% of Americans rated profits made by pharmaceutical companies as the overwhelming contributing factor to the high cost of prescription drugs. You've all talked about the R&D, the innovation, which there can be no question about that. But what is the value of these cutting-edge drugs and therapies if so many people can't afford them? And I think that widespread belief that Americans feel your companies are too focused on profits, it damages your credibility. I think the culture of your businesses and the culture of your customers. So I wanted to see how you feel about that in terms of the importance of people believing in your mission again, or believing as strongly that you are good leaders of the mission. Why don't we start with you, Mr. Duato?
Thank you, Senator. I can assure you that the 50,000 employees of Johnson & Johnson in the US wake up every day thinking what they can do for patients. And I can represent proudly that sentiment. What can we do to address the real inequity that exists in the US, which is that seniors and patients that need the medicines the most pay higher out-of-pocket costs? In my view, that's the real problem. There are other things that are positive in the US healthcare system, like the access to breakthrough cutting-edge treatments earlier than any other country in the world, but it's true, we have a real inequity there. I think we have to work together in order to address that inequity, and there's multiple ways that we can work on that. One is to make sure that...
Just give me one, because I want to make sure I've got a couple more questions.
One is to make sure that the discounts and rebates, we pay $39 billion in 2022, that we pay to the middlemen are passed to the patients so we can lower the out-of-pocket costs.
Got it. That's a good one.
So, Senator, I appreciate the question, and I can tell you at Merck, we've lived by the statement our founder put out, that medicines are for the patients, not for the profits. But so long as we've remembered that, the profits follow. And it really says we can both do good and do well for our shareholders together. And there's a balance. And I think what you're talking about is where is the balance? And we are always trying to find that balance. And I'm very much focused on it as the CEO of the company, because the legacy of Merck, the pride of our 70,000 employees and what we do matters to me. And a strong belief in the mission of the company. It's why I came to the company, and it's why I'm in this industry. So we are very committed to that. But I do think the challenge we continue to face is the structural issues in the system that are creating the problems.
We've heard that. I get it.
Yes.
Senator, the challenge that we're facing in this committee today and what we've been discussing is how do we ensure affordability today without sacrificing tomorrow's innovation? That's what we're focused on. We've got to make sure we do what you've heard from all of us, are bringing highly innovative medicines to patients. But we also have to do a better job of ensuring that we're bringing drugs like Eliquis to market, which save the healthcare system money. For every 100,000 patients on Eliquis, we estimate we save the healthcare system $5 billion. We've got to place a high bar on the medicines we bring to patients and stick by that as an industry.
Right. Well, and I appreciate that. And I do. Health is so precious to people that they'll pay almost anything if it's serious, so that in a funny way sometimes we see increasing costs based on that calculus of how much money are we avoiding, which I think can be a false pathway sometimes. But certainly as a user of Eliquis, and grateful, recognizing what the old system was and how better Eliquis is, I salute that. The higher cost in other, or the lower cost in other countries, you've all answered that. I understand there's some price setting there. But I think the solution, I mean, we're paying double. Even when you take out the PBMs and the list price from the net price, we're paying double what Europe or Canada and Australia are paying. And somehow that's got to be a negotiation that the rest of the world probably has to pay more, and you guys are going to have to figure out a way to do that. And I'm not saying it's easy, but it's one of those things. It's one of those things we have to address as a country and as an industry. I want to ask, earlier there was some mention of river blindness, of issues in underserved countries. I want to see if each of you have just a quick example of something where your company has gone in there. Obviously, we've heard about Merck, but done something in a country like that where it really was philanthropic.
Thank you, thank you. We dedicate billions of dollars every year to treat diseases that do not have an economic counterpart. For example, one of the diseases that we have contributed to its treatment and eradication is intestinal worms. You know, we donate billions of pills every year in order to treat intestinal worms. We have programs to support frontline healthcare workers in the developing world that have supported more than 1 million frontline healthcare workers. And we develop a medicine for multi-drug resistant tuberculosis, which is widely used in every single protocol, in which we are not enforcing our patents as we speak.
Right.
So
Thank you.
we've made significant contributions.
It's impressive, but most people don't know about that stuff. Mr. Davis.
Well, you mentioned the Mectizan donation where we
Yeah,
gave
that's
4.6
huge.
billion. I would add another one we did, recently. We were very focused on COVID now. We forget about Ebola and the scourge of Ebola that hit in 2014, 2016 in Western Africa. We actually, at no profit to us, developed an Ebola vaccine, have distributed that, continue to distribute that drug to address that devastating disease.
Mr. Berger?
Senator, we had, as I referenced, a large presence in HIV. I'm incredibly proud that in the late 90s, our foundation worked with governments and local communities to set up the core infrastructure to deliver HIV medicines to sub-Saharan Africa, focusing on children. The president of Botswana recently congratulated or thanked the BMS Foundation for saving a generation from extinction, his words. We are now leveraging that same infrastructure, partnering with Baylor College of Medicine to reverse something in childhood cancer.
Bernard, thank you. I'm sorry that his time has expired.